It's so fun to see a lot of familiar faces, but some new faces too. I'm Dr. Kristen Marvin. I'm one of the naturopathic physicians here in our office. You're in our movement center right now. If you've never been here before, our main clinic is just right across the parking lot. And this is really fun for us. Who has been to one of our community talks before? One person, two. Oh, Sharon, yeah, of course. So this is fun because years ago when Dr. Jeff Davis over here running the tech department this evening, when he first opened the clinic, this was something that we did on a more regular schedule. And then, of course, like everything else in the world, COVID hits and things kind of shift. So we're really excited to bring this back. Our goal is to try to offer this at least once a quarter. So we'll keep to that the best we can. So tonight I'm really excited to introduce Joleen Zivnuska and Kaylee Digby. They are both nurse practitioners in our office. Joleen specializes in women's health and Kaylee is a family medicine nurse practitioner. And tonight they're going to co-present on women's health and hormones. So thank you guys.
You gonna get started? Fine. Oh, am I? Okay. Oh. All right. What did you want to see? Because I was just gonna say when I was doing it. Oh, well, you see I'll do whatever you want.
Okay. All right. So you guys are, we're excited for you all to be here tonight. Obviously, our topic tonight is on functional medicine, approach to women's health. And so we're excited to get started on that today.
Absolutely.
All right. So kind of to start us off, we'll just start about what functional medicine looks different than maybe conventional medicine. So functional medicine tries to strive for root cause for symptoms. A lot of mainstream focuses on maybe pill for problem or trying to treat things with just more set, just this is what we do, this is how it's done for years. We try to use a little bit more evidence-based approach and holistic approach. And so that's maybe investigating and looking into labs and trying to understand things from, again, a whole full picture instead of just one moment, one problem, one thing. Especially was telling Joleen before we got started today that in my history and physical with my patients kind of in those first appointments, it's kind of rigorous because we want to hear the full story of somebody. It's not just, when somebody is 44, that's just in this moment in time. No, it's come from pre-birth, to today. And so we think that dynamic is super important to investigate and to try to help us to get to that root cause while trying to use things like a lifestyle approach or, diet changes or anything like that. Maybe sometimes supplementing if we need to supplement when we can't get enough into our lifestyle. But that's kind of our typical approach. So what, again, kind of we've learned through functional medicine is that symptoms warn us and try to communicate to us when something's not right in the body. So just because we have a symptom doesn't mean that we want to cover it up necessarily. It's the body's way of communicating that there's something, there's dysfunction, there's maybe a deficiency or something, broken potentially in the body that we need to aid and we need to investigate and try to figure that out. And again, that looks very different from maybe the more conventional side of things. Our bodies, crave that balance, especially when it comes to hormones and to many other processes in the body. And so I'm going to turn it over to you a little bit more with that. So,
Okay.
All right.
The pillars?
Oh, yeah,
Yeah.
I'll have the pillars.
Yeah.
So if many of you that come to Prairie Health, you see this plastered in every room. You see this in our lobby. You see this integrated, hopefully, in every appointment that we involve with our patients. We define kind of this as our Prairie Health and Wellness pillars of health. So wellness being kind of the top. That's kind of the overarching kind of goal of what we do, why we do it, right? It's kind of that basis there. Then underneath each of those, we have different pillars, but with the foundation, and I'll kind of talk about the pillars a little bit more, with the foundation being purpose. So the purpose is our why. Why is it important to work hard for our health? You know, what is the why? What is our motivation in the things that we do? Because sometimes doing the functional approach or the holistic approach is maybe hard. You know, it's maybe maybe limiting or harder in a challenging way. It provides a lot of benefit to living that happier, healthier, and more fulfilling life, but it gives us just that motivation into that piece. So we have kind of established through different things that several of us have listened to and different aspects, that these are kind of our pillars of health that we find super essential and that make a big impact even onto the hormone side of things and women's health. But this is kind of, you're going to hear us utilize these in as just being super foundational. So making sure that we're getting adequate sleep. Sleep is where we restore a lot of kind of that maybe dysfunction in our body while we're sleeping, different things like that. It impacts our immune function, our metabolic function, and has a lot of value to that. So you may hear as we also try to investigate kind of the why of why are we not sleeping well. It's not just, again, kind of that pill for problem. Everybody's different in what may be causing sleep dysregulation. So from things like trouble falling asleep or staying asleep or waking up at night and having different maybe night sweats or things like that. And all of that is crucial to our restorative sleep, you know, making sure that we're getting that 6 to 8 hours of sleep. Or is it the dysfunction that's caused by the technology that we live in and the screens that we're using, or those kind of things? And so investigating that is important to our foundation of health. Nutrition, obviously trying to utilize nutrition as a way to, you know, provide nourishment to our body and fueling our body, because each of those things have, you know, especially eating a variety of whole foods and things like that, kind of give us a variety of nutrients and vitamins and minerals that, you know, we don't have to supplement with if we try to eat more well-rounded in that kind of case. You know, things, yeah, in addition to fiber as well. Stress is a huge component, and you'll hear that as we talk more about hormones as well, and the impact that that has on the body. And that can be in stress in many different ways. I kind of say to my patients, like, that's physically, mentally, emotionally, spiritually, you know, metabolically, any of those kind of things can impact stress, and why we think it's important to work and investigate to try to support women in that way. And then movement, obviously, we need to expend energy to gain energy sometimes. And so that also helps with restoration and sleep and plenty of other different things in the body, as well as cardiovascular health and osteoporosis too. We'll talk about a little bit more as we go on. And then lastly, the detox pillar is learning about, toxins and eliminating them in the body. So again, toxins don't always have to be those kind of the big ones that we think of. It can be even situational or environmental or foods that we're eating, or just a plethora of different things that we can detox and try to get rid of those in our body, when it even comes to hormones as well. Okay.
No, keep going.
Thank you.
Keep going. Yep, you keep going.
So what do the symptoms of anxiety, heavy menstrual bleeding, insomnia have in common? You can, I'll answer it for us. It's okay. So this kind of all those things correlate with our body's autonomic nervous system's response to stress. So it's the protective mechanism that we were given for our body to react to stress. And so what happens is when our nervous systems are dysfunctioning in this state, sometimes it causes dysregulation. And so instead of being in more of our parasympathetic rest and digest nervous system, we're kind of in this other side of the nervous system, our sympathetic response. So it impacts each of these different systems in our body. So I'm going to finish with this one over here because that's what we're going to allude to next. But It impacts our brain and nervous system by activating fight or flight response, heart vessels by increasing blood pressure, heart rate, or those kind of things. Your body's response to if you're running from a bear. Essentially, think of those kind of things in there sometimes too. It can even cause, respiratory symptoms like shortness of breath, shallow breathing, or any of those type of things, impacting our digestion as well. So we get less blood flow to these organs in here because it's trying to support the most vital organs. And so it's taking away from, us digesting things well, and maybe causing digestive issues and whatnot. And then I'm going to bounce to musculoskeletal. It can cause muscle tension. When we're stressed, our bodies can be tight, and we're using up magnesium like no other when that takes place, and we can get tension and headaches and those kind of things. So then kind of what we'll especially talk about more today is kind of the impact on adrenals, and then also more importantly today, the reproductive system as well. So cortisol is released in the body to again help our body respond to that stress response. And then as for reproduction, things are shut down, as Joleen says. Your body is made to go into safety mode and protection mode, and things like libido, fertility, menstrual irregularities like we were talking about, and then increasing things like PMS symptoms and kind of those unwanted symptoms that we kind of see. So all of that kind of answers that last question that we talked about. Okay. And if too much stress, if we have too much stress from, these are just some of the examples that can lead to those symptoms that we talked about. So poor sleep, poor diet, gut issues, difficult relationships, adverse child events, demanding job, all of those things can provide a lot of stress to the body, and again, impacting it and taking away its regulation and aiding to dysregulation. All right, Joleen, this is you. This is her favorite.
Well, one of the things that how the body compensates is that it knows that if there's too much other stuff going on, which I call the non-essentials, and after 2020, we all know what non-essentials are. And so in the body, in the female body, that is making hormones. It can be metabolizing those hormones well. It can be growing hair and libido. So we don't have to have hair to survive. We like it, but we don't have to have it to survive. And so those things are always going to get shut down. And libido, definitely. So in all of my years of doing this, I've never seen a lady yet who's tired who wants to have sex. It's just a chore. We do it. We love the guy, but it's just kind of a chore. And so those are how our bodies try to protect us as females because of our amazing ability to grow humans. And so Mother Nature's kind of put up some guardrails for us and just saying, okay, but if there's too much stress, we're shutting this down. We don't want to be growing babies if we're in the middle of trying to run away from a tiger. Okay, so that's that whole part. So looking at adolescence, we were kind of going to try to give you a little bit of through the whole life cycle here. But with adolescence, and again, when we say that the ages, this is using a broad stroke. We all know that there's women are going to do things at different ages. Many times if adolescents are busy with sports or they're other things that are really maybe stressing them, they may not have the menses until much later, because remember, if there's too much stress, we're not making hormones, and so we're not going to have a menstrual cycle. But many times with adolescents, there's usually been a couple of years of anovulatory cycles, and those cycles are actually doing stuff. They're growing the breast buds, they're growing pubic hair, but we're making estrogen, but we don't have mature eggs to go into making progesterone and ovulation. And so, but those anovulatory cycles with that higher estrogen is oftentimes when we see, especially how that may affect emotions. And so many times moms will tell me, I don't know what happened to my sweet little girl, but she's slamming doors and she's crying and she's talking back that she never did before. And many times those kinds of things can be the high estrogens. So higher estrogen brains are just a little bit more susceptible to stressors and kind of quick responses. And so sometimes when we see that same thing happening with perimenopause. So what I've heard is when you have a perimenopausal wife and you have a 12 or 13-year-old daughter, dad's going fishing a lot. It's just a little bit easier. So, but estrogen dominance is what's kind of the name of the game at that point. That's where there is a supplement. All of you that see me anyway know that I absolutely love Vim Balance, and it is brilliant how the makers put that together. But it helps the body to pull down these higher estrogens and to balance cycles. And just even a couple of imbalance to these young ladies is just amazing. You get your sweet little daughter back. She's always been there. She's just been hijacked by hormones. So we can help. But a big thing to remember is that estrogen is what grows that endometrial lining and is part of what is then going to cause those heavier cycles. And that is never, ever, ever, ever normal. That is not normal to have heavy cycles. That's not how we're intended to be when our hormones are balanced. And so many times when that's happening, then we need to look into why. Why are we having all of these heavier cycles? So that's an important point. With pregnancy, again, of realizing that with best eggs, best sperm, best timing, and we really have about a 24-hour window to fertilize that egg, we've got about a 20% chance of getting pregnant. And so for many couples, they think that it's much better. Now the polyovulators, like the cats, dogs, pigs, they have an 80% fecundity rate. They're very fertile, but not us, where we just kind of do it one at a time. So again, proper expectations. And one of the things that I'm passionate about with pregnancy is over the years, I've seen many women who have had early pregnancy losses, and of realizing that oftentimes that is due to inadequate progesterone. And so here we try to encourage mamas to consider having their progesterone levels looked at if they're lower, and many times of starting on some extra progesterone. That then gets them to that point of where the placenta takes over, and then the placenta should have it from then on. Although some women still need some progesterone later in that as well. But that's a big help to be able to have ladies then go on to continue and have 40-week pregnancies. So perimenopause. So again, broad strokes. Generally, this is happening in the 40s. And we see ladies I've seen a lady with premature ovarian insufficiency at 28. It was autoimmune diseases part of the problem, but she was full-blown menopausal at that point. So it can happen at any ages. So again, the broad strokes are that usually this is about that 40th decade. And it's a time for a lot of women when there's many changes. The firstborns may be headed off to college. Parents may be starting to have some more health issues. And many times they feel like something just isn't right. I've seen 2 women who made this decision before they came here, but they divorced their husbands in the 40s and remarried them in the 50s. So it's an example of how things something isn't right. Another lady, they were out in the country, loved it. Husband had his own shop, and she's like, I got to get out of here. I got to get back to town. I can't do this. Got to town, and that wasn't it. She had a job that she loved, and she thought, okay, it must be my job. She quit her job. That wasn't it. And thankfully, she had enough friends to say, hey, you need to go get your hormones checked. And so she came and got them to be more balanced, and life was good again. So it's the older eggs that's the problem. We ovulate out as best eggs first. That's why those adolescents so easily get pregnant. Best eggs, best sperm, probably ever going to have in your life. But when we get into the 40s, we're starting to get into the older eggs. And it's just a dysfunction of that estrogen and progesterone balance that should be there, that many times with these older eggs, we're making more estrogen as part of their dysfunction. So the estrogen, again, is what grows that lining. And so many times can set us up for having heavier cycles or that. So some of the symptoms of perimenopause, again, and this is just a fraction, believe me, I mean, there's probably at least about 50 symptoms, but hot flashes, crawling skin sensations, frozen shoulder, brain fog, tummy fat that came out of nowhere because nothing else has changed as far as her diet, her exercise, her sleep, decreased libido, heart palpitations, weight gain, memory issues. You go into a room, you can't remember why you're there. sleep disturbances. So many of those things are actually perimenopausal symptoms. So we're not on the freeway to dementia. It's just actually that hormones and everything are not working quite like they used to. So when we look at when perimenopause kind of hits the fan, is kind of how I say it, is usually about 45. And many times with the older eggs, they're not ovulating as well as they used to. So when that happens, we're making these higher estrogens, but then we're not ovulating and making the progesterone that we should be having to balance that out. So again, we're in a higher estrogen situation. So many times when we don't have enough progesterone, and again, that progesterone is the last 2 weeks of the cycle, then we're not many times having the ability to go to 28 days. And so that's when we many times see cycles being 25, 24, 21. And those ladies are really going to be at risk as far as for becoming anemic. And who wants to have a cycle every 21 days anyway? I mean, it's all for the birds. But that's what's happening because of that anovulatory process that usually starts about 45. So there's kind of different ideas about hormone replacement. Some people feel like you shouldn't give it until a lady hasn't had a period for a year. And I feel like that's cruel and unusual punishment. So I start it right when symptoms are happening. So when she's starting to get those shorter cycles, then of adding progesterone in for that last 2 weeks, that should help get her again to more like a 28-day cycle. But also progesterone is kind of Mother Nature's natural chill pill. It just helps us to sleep at night. It helps us to just see that the world is still calm, all that. And so it just helps them to be able to go on to like the next steps and not be, because if we're not sleeping, then many times that's when it all kind of falls apart with emotions and depression and everything else that can happen at that time as well. So some of the risk factors that we see for perimenopausal women, especially 45 to 55 with those higher estrogens, that's when the incidence of breast cancers and uterine cancers rise exponentially. And that is certainly what I have seen in our practice as well. And so that's where I like to start FemBalance, that supplement that helps the liver to get the higher estrogens out. I like to start that at 35 so that we're already working on keeping those higher estrogens under wraps before we get on into the 40s. So, and later on in the 40s, kind of about 46, 47 is when ladies will start skipping cycles. And many times that is where she may have 2 cycles in a row, and then maybe she doesn't have anything for 2 or 3 months. And then she may have 3 cycles in a row, and then she'll have some more. But when you haven't had a cycle for a year, that's when you're considered menopausal. But to have, to go through when you have hormones since you were probably 12 years old every month, to then starting to skip, that is really hard emotionally, physically, everything as well. And so that's when I bring in estradiol and also testosterone as far as to help with, along with the progesterone that they're getting the last 2 weeks of the cycle. Now we just put it in that it's going to be every day. So she has a baseline dose of hormones. So there may be some months when maybe she has an ovulation. She's going to go a little bit higher. She may have a little bit of breast tenderness that month. But then for the months down here, the 2 or 3 months when she doesn't have a cycle at all, she's at least got this maintenance dose there to help her keep going during that time. So again, we just really want to, all those pillars that Kaylee was talking about, and sleep being one of the main ones. So especially when I've been starting the progesterone, I've had many women say, "You're never taking that little white pill away from me, are you?" Because they're just sleeping so well. So when we get on into menopause itself, and usually in the United States, that's about 50, 51 is usually when ladies are menopausal. I have seen women 56 and having monthly cycles. So again, it's just this, we're speaking with a broad stroke here. But for some of these ladies, especially when we first start to initiate some hormone replacement for them, they have many times, so those anovulatory cycles on the end of perimenopause, just like they started out at ages 10 and 11 before they start their periods at 12. And so we may see thicker endometrial linings. When we start hormones, it's not uncommon to have some irregular bleeding because the endometrial lining is what's up. Haven't seen this for a while. And so that first year after starting hormones is actually when we many times will see, we may see, and it's not alarming to have some irregular bleeding that's there just from starting that. So when the sex hormones are not kind of doing what they should be doing, then many times that's when the adrenals kick in and saying, hey, we got to give energy, we got to keep the body running, the thyroid's kicking in. I mean, it's all hands on deck. We're trying to make up for what the sex hormones weren't giving before. And that's many times of when cortisol, again, being the strongest hormone in the body, but also the most inflammatory, many times that's when ladies will start to notice that they're growing a tummy. And they may feel like I'm not, nothing's changed, and my diet hasn't changed, my exercise hasn't changed, what's happening? I can't fit into my favorite jeans anymore. And many times that's because of cortisol, which is the strongest hormone in the body, also the most inflammatory, but it loves tummy fat and will create it because it can store 3 times as much cortisol in tummy fat as it can lean muscle. So you may have 6-pack abs, but if you're not sleeping, then with enough time, you're probably going to start to have a tummy from your body storing cortisol there. And the ovarian hormones, again, by that point, they're gone. It's just of what we can give ladies. We know that looking at starting hormones as well helps to prevent cardiovascular disease as far as like with dementias and being able to prevent osteoporosis. And so we live about a third of our lives in menopause. And up until fairly recently, that has been years in just decline. And I don't know about you guys, but I'm not interested in that. I want to be like Queen Elizabeth and still riding my horses in my 90s. So if I'm going to do that, then that means that I've got to be making an investment in the body. I've got to keep it going. I need to keep muscles strong and to keep them going, not only for strength of being able to ride, but have balance, but it's also so that you don't die of pneumonia because you can't cough enough or you don't have muscle strength enough to get the crud out of your lungs. So an amazing book is called Forever Strong by Gabrielle Lyons. Absolutely love it. If you want to look at what muscles do for us, it's incredible, and I would encourage that. It's a wonderful book. So knowing again that we want to prevent things, we want to be able to keep our bodies going. It's also the energy, I think, that comes, and that many times also to the libido. So again, when I have seen in my past travels earlier on, there really wasn't much available for ladies as far as hormone replacement. I've seen the vaginal fourchettes even split like a paper cut because for the vagina to stretch is an estrogen function. And so that wasn't happening. And what was occurring many times were divorces where lives were getting turned in for younger models because many times their 65-year-old husbands were not done with intercourse yet, but for them it was just too painful. So of being able to come up with the creams with the other hormones to be able to have that stretchability there, but also just even the desire to be there. So what I'm trying to do is to help women to thrive in menopause and not just survive, but to actually have a libido again and to enjoy faster and stronger orgasms. So you want to do it more so that it's not exhausting before you can actually achieve an orgasm. And that's what adding testosterone, especially, but it's the combination of the progesterone and the estrogens as well. It's all of that that makes that go. And so again, it's exciting to see couples get even stronger instead of like splitting as they're getting older. They're even getting stronger in their love and their care for each other, just of being able to want to spend time together. And I think that for many couples, that's one of the most ways in which they can feel like they feel loved. So looking at estrogens and all of those, testosterone as well, but things that when we look at ladies in the menopausal years, that heart disease is the #1 killer. So if we look from 55 on out, heart disease is the #1 killer. The second is ramifications around the hip fracture. So a third of all ladies that have a hip fracture will die within that first year afterwards. And many of them don't even make it out of the hospital because of large clots, either strokes, heart attacks, that sort of thing. So prevention, again, is the key. And that's what Prairie is all about, is preventing things, being able to get optimal health, but then preventing for the future. And so one of the things that we do is part of our whole membership is every year of getting a DEXA scan, which looks at our 4 lowest lumbar spine, where we often have fractures, and then also the trochanters of the hips. And we know the recipes for growing bones back and for increasing our density. We know how to do that. And so we shouldn't have anybody having a hip fracture out of this office except for maybe a motor vehicle accident. And we watch this every year. And so are we improving it, or are we going the other direction? Because it's actually an inflammatory condition, hormonal condition. There's a lot of things that are a part of that. So that's one of the main things that we can look at with our member labs. We have tried to get the cardiovascular data, and Dr. Davis was passionate when we first got started about wanting to do advanced lipid testing and getting some genetics of things like Lp(a), which is in about 20% of the population. It's like Velcro to an arterial wall, causes clots. And so we sent his blood, my blood, all over trying to figure out what labs he wanted to work with. And it's been exciting to be able to offer that to ladies when we see especially a stronger family history of cardiovascular disease, and knowing that as they get older, that's going to be the #1 killer of women. I mean, we need to be all about that. And so I'm so excited that that's things that we offer, as well as like with the member labs, that we're focusing on those main killers, if you will, of women, and being able to prevent that. So do you want to talk about the body comp at all, or? Yeah.
Yeah.
So this is another part that Kaylee does that I don't touch.
So another part of just going back to even like the nutrition pillar and movement pillar is that we do offer a body composition scan every year to our patients. And why is that important for hormones and everything too? But it also helps us to see where our lean mass is, our fat mass, and kind of work towards nutritionally to be able to support the body as they are going through hormone changes. And Joleen will talk a little bit about her newest favorite book currently, that aids in this, but we talk about what visceral adipose tissue is and how it impacts our metabolic health along with a resting metabolic rate. And a lot of women, come to find out, are not eating enough. They're calorically deficient, and they're causing more stress on their bodies and making it harder for their bodies to want to produce any hormones or even utilize the hormones that they do have. And so we utilize this as a tool in a lot of different ways to help help for progress, motivation, and even to help us to just try to motivate and work on nutrition changes too. So if you want to
over the years, there have been ladies have asked me, do you have a favorite book on menopause? And I'm like, haven't found it yet. But actually now I can. So if you're a reader, Mary Claire Haver is an OBGYN in Galveston, Texas. And she is a traditional OBGYN. So I don't agree with everything. Like she says that you don't need to give DIM, which helps to metabolize estrogens and hormones. She says you just need to eat enough broccoli. Yeah, not for my taste anyway. I think I want a little bit more than that. But when it comes to hormone replacement, I agree with everything that she says. And she is just right where I am, that we are not interested in 30 years of decline. We are wanting to move that needle to where we're going to have women thriving in menopause. And for many women, especially when they get to where they're in their 50s and children are settled, and no mama's settled until her children are settled. But when they're settled, then it's their life, their freedom that they haven't had until probably from their single days. And so it's exciting to see what women are doing now in their 50s and 60s and 70s. So anyway, that's that plug. And just for nutrition, because I think in perimenopause it can be tough with the cortisol piece of this. Many women are wanting help with how can they be losing weight. And so anyway, Fast Like a Girl is looking at fasting from supporting our hormones. And so when keto was kind of the rage, I saw the negative side of keto. I saw ladies losing their hair and missing and not having their cycles and irregular bleeding. And she even goes into that of, as far as why from a female body where our hormones change. For men, that was pretty great because their hormones don't change much. But for us, our body needs different things at different times, especially of having lower carbs during the estrogen phase, higher carbs during the last 2 weeks of the cycle, but not fasting, not intermittent fasting as far as like that week before the cycle, not stressing the body that much like what Kaylee was talking about. So I've been excited to see ladies use this as far as to, from my heart for infertility, I've seen ladies that are getting their progesterone levels high to where I thought they were probably pregnant, and they did it because they were fasting like a girl. So she has a lot of detail, which was what I was looking for. Basically kind of tells you what to do as far as intermittent fasting, but to break it and go into eating protein and into eating carbs. And that metabolic switch is what is happening as far as decreasing insulin resistance, which is a big perimenopausal problem, and also just losing weight. So I've had success with it as far as on the infertility front, and then now many ladies that are into it as well as far as just for insulin resistance and weight loss. So just another thing, there's not one thing that's for everybody, but she has a lot of detail, which I think a lot of ladies are going to find helpful. So just wanted you to know about that. She's been doing it for decades, so she's gotten a lot of the bugs squeaked out of it. So we have some time left as far as if there's any questions that you guys have. Sorry. Yeah.
I heard an interesting statement I wanted you guys to talk about. You can't out hormone your lifestyle, and you can't out lifestyle your hormones. Meaning you can't do one or the other. You kind of together.
Well, I would kind of disagree. I think that you can have the beauty of both of them. As far as if our lifestyles will support us making hormones, then they know this body knows how to heal itself. And many times we get in the way of that. But it's always trying to right the ship. It's always trying to heal itself. And so many times hormones is one of those things that we don't have to do it to survive. And so it's always going to be the thing that's going to get shut down the first. And so that's where we see so much of the irregular bleeding and irregular cycles whenever there's stressors that are going on. But if the lifestyle doesn't support making hormones, okay, it won't do it. But otherwise, so if we want to have those balanced menstrual cycles, then it's being able to have like those pillars that we were talking about of making sure that we're doing that, and then voila, cycles will come back. And it's exciting to see that happen, where many times other ladies may have been told by other physicians, you're in premature menopause, this is blah, blah, blah. And then I always wanted to be around, what would that physician say when their cycles come back, when the stressors are off? And so it's very predictable. That's the beautiful thing about functional medicine. Many times we can almost know, like a stack of dominoes, what's going to happen, if we don't do these other things first. And so I think that we can, if we're willing to put the work into making the lifestyle happen.
You address taking hormone replacement therapy if you have family members that have a breast cancer.
Right, absolutely.
I'm going to repeat the question.
Oh,
Yeah.
okay.
So the question is, how do you address hormones for those that have had a family history of breast cancer?
Yeah, absolutely. So many times of realizing that, let's just say, if my mother had breast cancer at 37, the younger that you have it, the more risk it is for you if it was yet less than 50. So I am not my mother. She had her own stressors that I don't have. And so realizing that the body that allowed cancer to proliferate had some deficiencies going on, and that doesn't necessarily mean just because of that. But the biggest thing, if you wanted to really find out, is to do some genetic testing to where you would know whether you do have some of like BRCA1 and 2 are two of the highest as far as uh, potential cancer risk as far as breast cancer. But even with the BRCA1 and 2, by doing the anti-inflammatory lifestyle and functional medicine, then those women are able to stave that off. And so again, we all have cancer cells inside of us, but it's just whether they're allowed to proliferate or not, which is one of the things that Dr. Pelt says in Fast Like a Girl, that if we do some of the extended fasting, you kill the cancer cells in your body. So there's a lot of things that we can do to offset that. And I think it's basically looking at the pillars, though, is a big piece of that, because that's how we help this body to heal and to keep at it safe. So with my mother having breast cancer, I got my first mammogram at 32 because she had hers at 37, but I'm the only one out of 3 generations that hasn't had breast cancer yet. And so I do take supplements. My husband kind of cracks at that. And I said, you know what, it's cheaper than chemo. And so it is of the choices that we make and of being able to utilize things like the prevention that we get with functional medicine is how I think that we can beat that. So.
Joleen, can you talk a little bit about why a woman off of hormonal birth control may benefit from a
So with looking at different contraceptives that are out there, that whenever we don't have an ovulation, then we're not making estrogens. And so estrogen, again, one of the biggest things as far as stimulating to increase the bone density. And so that's primarily one of the bigger reasons. And it's also but the stressors, the other things that can go on as well, as far as inflammation being a big one, that decreases bone density. And so thankfully we can offset that as far as with some of the supplementation that we do, the lifestyle, to be able to help the body to build that density back. And that's the exciting thing of doing these yearly DEXs, of watching women who are 75 years old still improving their density. That's very exciting. I mean, and I've even had their primary care physicians wanting to see their DEXs and then are asking, what are you doing? And it's like, yes, somebody's asking, what are you doing to get an improvement at that age without using medications that I think are actually going to take us in the opposite direction. So.
Can you talk a little bit about the Women's Health Initiative study that I think a lot of people's doctors will often reference as to why hormones are bad or why women shouldn't use hormones?
Yeah. So this was, there was a time of when they were really trying to actually do some research with women, which I applaud, because in medicine, women's research has been pretty abysmal. But it was a nationwide study, and they were using 2 of what I think are the worst hormones known to man. And so hence that's where I think a lot of the problem came in. But it was Premarin and Prempro. So Premarin is made from pregnant mare's urine. So it wasn't even a human estrogen, it was an equine estrogen. And then they felt like they couldn't patent a natural occurring progesterone, so they made a synthetic progestin, which is Premarin, a combination of Premarin and Prevera. And Prevera is like category X, which means if I gave it to a pregnant mama, it could kill her baby. Okay, so this is, when you think about an inflammatory medication, that's Prevera. And so back in the days when I was working in reproductive endocrinology, whenever we were trying to stimulate cycles, and if a lady didn't have a period, we wanted to withdraw them with Prevera, but we always had to get a pregnancy test first before we did that because of that whole issue. So you got, and the Prempro was really the stinker of the study, but there were many. They had women there wasn't any cutoff in ages, so they had women that had been menopausal for 15 years that they started on hormones. And we like to start ladies right away with hormones, and so we get that prevention piece. So that was there. And then where they found some issues was definitely in that Prempro arm. And they felt like it ended up being about 2 per 1,000 women, but of some breast cancers and also some heart attacks. And so cardiovascular was an issue with it, as well as breast cancers. The Preventative, the estrogen-only arm, the equine estrogen-only arm went on, and they didn't see that with that one. It was in the Primpro arm or where it was an issue. So it was also very frustrating because I've done a lot of FDA clinical trials, and there were a lot of deviations from that trial to where when they noticed some of the issues with Primpro, they put it out to the news that estrogen causes cancer and heart attacks and all this. And so where normally you would not do that until you don't go to the press, you don't do anything until the end of the study, and you have a team of statisticians that tell you whether this was statistically significant or not. Well, what happened, that was in 2002, and I was in a big general OBGYN office, and it was like a tsunami hit the office because a lot of family docs who did not really want to be doing hormones anyway, just cold turkeyed women off their hormones, and some of the OBs were doing that as well. Well, these women were coming in just drenching in sweat and in really bad shape. And we're saying, is there anything at all that you can do? We were even asking the Premarin rep, what are they talking about? What's happening with this study? The Premarin rep itself couldn't even get a hold of the information, didn't know. So it was really a horrific time. But because of that, a lot of physicians kind of just made that line in the sand. I'm not doing hormone replacement. That's going to kill women. But unfortunately, just a couple of weeks ago, I heard that very same thing, where the lady said that her primary care physician said, you don't want to do hormone replacement. That's going to give you cancer, and that's going to kill you. So, and I said, so was he about 65 years old? And so part of it is that it takes time to do hormones. And, you know, the average visit in primary care these days for traditional medicine is about 7 minutes. That's not much time to talk about hormones. And so for a lot of them, they just don't want to take the time. They don't want to learn it. They don't want to do it. And so it's not only that stuff's going to kill you, but what I think the kicker is, because there's kind of this thing in medicine that if I don't know how to do it, you don't need it. That many times there's also, then they add in, and by the way, that stuff's going to kill you anyway. And so it's so sad that women are still getting that outdated information. Everything but maybe one thing of the WHI has been rolled back to be not true. But again, of proving it then when you use actual hormones that the body makes, then the body knows what to do with that. So we're seeing the opposite on the other side.
Backpack off of that, Joleen, is there a preference for women, and it's maybe individual depending on the woman herself? Someone that's like perimenopausal, they know they're heading towards menopause here soon. Is there a preference between injections versus pellets, or is that just it really depends on the woman?
Yeah, and talking about primarily testosterone, or yeah. So the concerns that I have with pellets, I certainly understand the convenience of it. It's once every 3 months. I get that. But the concerns that I have is that you can't take them out. And I work with a lot of ladies who are sensitive or who may have acquired problems to where we really don't want higher hormones to be on board. So some of the ladies that with pellets too, I only see the ladies that are not doing well. They wouldn't come to me if they loved them, you know. So, and they had really high levels to where it was almost at a man's level. And so all I could do was support their livers to detox because it's with them. We can't get it out. So the other thing that ethically is, and this is me, but I've kind of been on the hormone train since the very beginning, even before WHI and through WHI, and a believer in hormone replacement. And so for many docs, that wasn't an issue until frankly they could make money with it. A doctor doesn't, or a nurse practitioner doesn't make any money sending a script to Dillon's. But with the pellets, they can double the price and sell it to you. So now that they can make money, hormones are back. And that's just my own personal bias that just doesn't sit well with me. but I will own that. That's my personal one on that one. The big reason that I don't like them is just because you can't take them out. You don't have any control over them once they're there.
Can you explain how we monitor hormones once women start so they're not so
Yeah, yeah. So we have a lot of different options as far as even of what we give, whether it's, we always want to do hormones through the skin. We don't want to do oral hormones, especially oral estrogen. That's probably about a 30-pound weight gain. But of going through the skin, whether it's troches that we can use vaginally, we can use them in the mouth. The buccal troches, little squares, was all the rage a while ago. But what happens is that we many times just get higher estrogens because it goes through the liver to be metabolized. If we go through the skin with like an estradiol patch or the little troches that we can use vaginally, then we're actually absorbing the hormones and they don't go through the liver to be metabolized. So that saves a lot of clotting issues and other things on down the road. But when we have, or we can do testosterone injections, and is anybody here on testosterone injections? And kind of have had some had some frustrations. We actually have a much better situation with our injectable testosterone to where it's going to be low cost and easy to be able to get. So that's the exciting news. But when we start hormones, then we have ladies come back in 6 weeks and we are monitoring their blood levels. So there's many physicians out there doing hormone replacement that don't check labs. They feel like if you feel good, you're good. So we're going to go. But let me tell you a story about that. So I had a lady that was on injectable testosterone. Her husband was giving her shots and he was on testosterone as well. And we came back and her estradiol was around 1,000. And I'm like, so I called her and I said, so how you feeling? And she was like, well, I feel great. I have all kinds of energy. Libido's wonderful, all this kind of stuff. And I said, so tell me about your injections. Well, long story short, her husband was injecting his and not hers. So, but she felt great at that point. And she didn't want to change. And I said, no, I'm sorry, but this is not sustainable. You can't do this. So her body could take it for a little while at that level, but she was really gonna probably have some more issues as far as with facial hair and many times oilier skin, maybe some acne if things get a little bit too high. So it's checking those levels in 6 weeks, and then we go from there to see how they're doing. If they have any issues, if they say I'm not feeling good, I always want labs, because remember, if she was just in a car wreck, how she metabolizes hormones is going to be altered. And so those labs come back to tell me, it's like objective data of what are you doing. And it's amazing to see the same prescription, but such different lab values depending upon cortisol and kind of what's all going on. So, and we check them once a year otherwise, but if there's issues, then that's when we want to get everybody in to see what's happening with them. So.
What about oral progesterone?
So with progesterone, the main reason that I like to give it as a capsule is, number one, it's cheap, it's generic, it's probably 30 years old. GoodRx gets you even cheaper with that. But when you do it orally, and that is the caveat of one that I will say is oral, you get more of a sedative effect from progesterone if you give it orally. But for ladies who may be more sensitive, then many times we can actually use that capsule vaginally. So the vagina is just an amazing place to give medication. We're totally missing the boat on that. We should be putting antibiotics, everything there. In fact, there is a contraceptive called NuvaRing, and it has estrogen progesterone in this ring. I went all the way to the top of the marketing department of NuvaRing to ask them, would you consider, you guys are sitting on a gold mine, you should be putting antibiotics in this ring and everything else. And the guy said, great idea, but we don't have the patent for that. We have the patent for NuvaRing. We don't have the patent for the ring. And I'm like, well, whoever that is sitting on a gold mine and not developing that. So you get the hormones where you really want them in the vagina, and the progesterone absorbs very well, but not having quite as much of the sedative side effects that for some women, they may not metabolize as well and they feel kind of really tired in the morning, hard to wake up. That's not exactly what I want. I want a really good night's sleep, but I want them waking up energized and feeling like that was a good night's sleep. So using it vaginally can be a way to avoid that.
Can you use the no ring for hormone replacement?
No, it's a contraceptive.
Yes, you could.
You could, but you would be, yeah. And the really, honestly, the big problem, it does not have any competitors, and it's $250 a month. It's my favorite, one of my favorite forms of contraception. Of the combinations, it is. My favorite's Mirena IUDs, but it's $250 a month, so kind of prices itself out of the market. Well, I want to applaud the men in the room. Thank you. Thank you for coming and wanting to understand your wives more and support them. I appreciate that. I always love it when men come for hormone consults and stuff. That's a fantastic thing. So, well, Kaylee and I, Shireen's back there. Everybody grab your person you want to talk to if you have more questions, because I know sometimes they're a little bit more personal and people don't necessarily want to ask in front of a group. So,
Thanks everybody for
Yeah,
coming.
thank you.
yes.
Thank you.